Hello, friends, and welcome to the October 18th edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about public policy issues here in the great state of Texas and have a conversation about how you can engage in the process. My name is Scott Atnip, your host and Texas Impact's Engagement Director, and today's episode is brought to you by Methodist Healthcare Ministries of South Texas and Friendship West Baptist Church in Dallas. So, a couple of quick notes at the beginning today. Tomorrow is the final day of the third special session of the Texas Legislature. They're going to adjourn sine die tomorrow on Tuesday, and we will continue to wait to see what happens next. Quick programming note, we will not have our legislative update today, but we will have Josh come in next Monday for a legislative wrap-up of the third special session. We will not have a live chance to participate in that next week. Full disclosure, I have jury duty on Monday. So we're going to pre-record that episode and post it in the YouTube feed and podcast feed next Monday afternoon. But for today, we are excited to welcome to the conversation Dr. Marc Boom, President and CEO of Houston Methodist, an institution consistently ranked among the best hospitals and one of the best places to work in the United States. So Dr. Boom, we're honored to have you join us for the conversation today. Thanks for the time.
Thank you. It's great to be here.
And I'm going to start by saying just a moment of personal privilege, I guess. I am a United Methodist and live in the greater Houston area. And on behalf of all of us, I'm just so thankful for the work you and your team and health professionals throughout Texas have done over the course of the last year and a half. I can only imagine the stress and the anxiety the last year has provided, but we are so grateful for the leadership you and others have provided. So thank you for that, first off today.
Well, I appreciate that. We have 26,000 amazing men and women working at Houston Methodist across 8 hospitals and our physician organization and research institute, all of whom have been working extra hard, as you can imagine, this last 18 months under very stressful conditions. It's been a rough time. And so that is very much appreciated. Thank you.
You're certainly welcome. So let's jump right in because speaking of anxiety, the Texas Impact team and I were watching the legislative hearings last week, talking about the vaccine requirements, the vaccine mandates, and the legislation that's moving forward on that. And many of the statements that were made, especially in public testimony, didn't match the research that many of us hear from public experts. So remind us again, I'm hoping that all of our listeners have this information down pat, but remind us again why vaccines are so important.
Well, thank you for that. And, unfortunately, there is tons of misinformation out there. And sadly, much of that now being spouted many times, in legislative kind of settings, sometimes by legislators. I mean, I've seen a U.S. senator spouting misinformation, for instance, very recently, and it's very distressing. I mean, we tie it back to what you were asking me about with our 26,000 employees. If there's been one thing that's been really tough for our employees to deal with is watching surges happen, watching suffering happen, and then have all this discord and all of this debate over things that the medical community really knows and has a very, very consistent consensus around. I mean, to put that in perspective, the AMA, the American Medical Association, reports that 97 to 98% or so of physicians are vaccinated. So they're voting with their feet and leading by example. When we had vaccines become available for the 12 to 16-year-old group, if you remember, that kind of happened after some of the other. The night it came out, because it was like 3-4 in the afternoon that we finally had the go-ahead, we could do it. So most of it was going to start the next day. Guess who was there? Every one of our physicians with their teenage kids was lined up getting their kids vaccinated. And so, if there was one wish I had, it was just that people would tune out all the other piece and listen to the physicians. If you do that, you can't go wrong. So let's talk about the vaccines. They are hugely successful and hugely safe. It's really quite impressive. If you look at the vaccines that are used in the United States, collectively, hundreds of millions of doses have now been given. One of those vaccines is fully FDA approved now for adults, which is Pfizer. Moderna hasn't quite gotten the full approval, nor has J&J. So let's just talk about Pfizer for a second. Pfizer is fully FDA approved. At the time it was fully FDA approved, they had the experience of having given it to hundreds of millions of people worldwide. And, couple 100 million doses given in the United States. There is never a time that I can think of in the history of modern medicine where a drug was approved that had already been given a couple 100 million times. So it couldn't possibly be better studied than it was. And so let's talk about what it does. We know that prior to Delta, and I'll kind of give you some pre-Delta variant and post-Delta variant. Prior to Delta, we know that when these vaccines came out, they were 95, 96% effective at preventing infection, period. You didn't get infected. They were 99 to 100% effective at what really matters, which is keeping people out of the hospital and then keeping people, obviously out of the morgue. And sadly, we've lost 700,000 plus people in the United States to COVID already, which is a shocking and horrendous number. And I can tell you in our hospital system, the number of deaths and the amount of suffering we've seen has been horrifying. And so they're wonderful vaccines. Then Delta came along, and Delta probably came along at a time also, whereas we learn about the durability of these vaccines, there may have been some waning of immunity as well. But mostly Delta just spreads like wildfire compared to the coronavirus before. And so what we saw was their effectiveness in the real world at preventing infection went down, still very high, still probably as good as a flu shot, which we all go get every year, but not as good as we would have liked. But their effectiveness at preventing serious infection and death remained very high. And again, now we're able to boost that with some additional boosters, which we can talk about. So then you get into the question of safety, because this is where most of the misinformation comes out, right? Some of the misinformation out there, and I'm happy to talk about that, is really around, are they really effective? Do they really prevent infection? Do they really prevent? And I can unequivocally say, yes, they're very effective. So then the question comes down to safety. And the reality, as I said, is that these things have been studied more than any other drugs kind of in the history of the planet as we are, rolling them out. And they are amazingly safe. The major issue we deal with across all vaccines and all drugs is an allergic reaction. And so that's the thing that we were worried about. Fortunately, it's rare. It's very treatable. You're talking on the order of 1 in a million or something like that. To my knowledge, there's not been a single death reported from an allergic reaction, even a very severe one, because we can treat somebody rapidly with epinephrine and block that. But again, in the order of 1 in a million. Put that in perspective. Remember, 1 in 500 Americans have died from COVID. 1 in 500 versus 1 in a million that you might have some, rare, severe infection, allergic reaction, that then is fully treatable. That's really, really easy math. But oftentimes, obviously, we struggle with kind of the immediacy of, well, am I taking a risk here now when they put this shot in versus the perceived risk that might be a month out or 2 months out or 3 months out or 6 months out. So if there's one fundamental message today, please go get vaccinated. You can protect yourself. You can protect all of the people around you. You can protect your loved ones, and you can protect people who cannot protect themselves and who desperately want to do so, but they are not able to take a shot because of a medical contraindication, or they're a transplant patient or a cancer patient, and we can give them 3-4 shots and they probably still don't mount a great immune response because their immune systems don't work right, which also means they're at extreme risk of COVID if it actually hits them.
So we are recording in the noon hour on October 18th. So just in terms of when people are listening to this, but yeah, as of now, where are we in terms of recommendations on booster shots? I know we're not there yet for under 12. I have a 5-year-old or a 6-year-old that's really excited to get to that. But where are we on recommendations for booster shots right now?
Yeah, that's a great question. So let me the 5 to 12, I think we're within weeks of approval on the 5 to 12, which would be great. I mean, if I had my youngest is 15, and we actually enrolled her in one of the trials. So she was one of the Moderna trial patients that they used to prove that it was safe and effective in kids, to give you an idea of our trust in the vaccines, but also, wanting to get her protected as soon as we could.
Yeah, my 14-year-old is bragging to my 6-year-old that she has the shot and he doesn't. So,
well, that's good. That's good, and it's good that your 14-year-old has that attitude, is what I mean. And we'll get, the 6-year-old will be soon. And if that were my 6-year-old, and you'll see it with our doctors again, as I talked about, they'll be lined up to get it. So it gets a little complicated, but I think it's going to get a little simplified soon. So let's start. If you had Pfizer and it has been 6 months since your second dose, there's a good possibility you qualify for a booster shot. And if you qualify, I would say go get it. If you're over 65, you qualify. If you are 18 to 64 and have a significant medical issue, you qualify. It's pretty loosely defined. So, that covers a lot of people. And if you are 18 to 64 with an occupational risk, a doctor, a nurse, a school teacher, a grocery worker, or any really other occupation that you believe puts you at high risk. I was talking to a colleague recently who travels a lot. I said, well, listen, you may not technically be one of those, teacher, et cetera, but you're on a plane all the time. I would put you in a high risk category. Go check the box, go get yourself a booster. So if it's been 6 months and that is the case, go ahead and do that. Now, there's a couple subtleties in there. You'll note, 16 and up is approved for a first and second dose, but they only did 18 and up for the booster. Now, Pfizer is also fully FDA approved above age 18, meaning if you don't meet one of those criteria, a physician can always write you an order. So if a patient calls me, I'm still practicing a primary care physician, and they want a booster and it's been 6 months, I'll write them a prescription for a booster if they don't meet one of those criteria. So most people who've gotten Pfizer can go ahead and do that. And we'll probably see, additional categories of people added to the list. But the bottom line is if you want a booster, you can pretty much go get one. If you got Moderna or J&J, it's less clear, but I think we're going to have clarity within the week. So last Thursday, the FDA committee that makes advice on this met about Moderna boosters and essentially recommended the exact same approach as for Pfizer. 6 months out, those same categories I talked about. That goes to the CDC in a couple of days. And then after the CDC, we expect it'll be approved. So I think within the week, it's going to be exactly the same whether you're Pfizer or you're Moderna. On Friday, the last Friday, 3 days ago, they met to talk about J&J. Now, J&J, if you remember, is a one-shot vaccine. Initially thought that one shot will do it, but the reality is it looks like it has significant waning of immunity. It probably needed to be a two-shot vaccine to begin with, and they didn't, sort that out early. So what the FDA on Friday said is if it's been 2 months since your first dose of J&J, they're going to authorize a booster for anybody. And it won't be a third dose booster. It'll now be a second dose booster. They'll sort out third doses much in the future. And so I think that will also probably happen by the end of this week. Then the final question people always have is, well, what about mixing and matching? I had I had a J&J. Should I go get a Moderna? All those kinds of questions. And I don't think we're going to have clear-cut guidance on that yet. The reality is if you want a Pfizer booster, your doctor can write you a prescription for a Pfizer booster no matter what you got. So if for some reason you decide that's what you'd like to do, you can go do that, but you can't really technically go out and do it on your own. I say technically because it's not very hard to go to most vaccine sites and get a vaccine. I mean, you might have to check a box that's not really true. I'm not recommending you do that. I'm just saying the reality that is happening out there by people who have taken that kind of into their own hands.
Well, thank you for that. Moving into kind of the legislative piece of it, and I know you've had some public comments on the next question I'm going to ask you, but the Texas legislature is considering a couple of bills that would prevent local governments, congregations, businesses, pretty much anyone else, from enforcing vaccine requirements. So, from a public health perspective, what would you recommend? What voice would you add to that conversation?
So to put that in perspective, Houston Methodist was the first hospital system in the country to mandate vaccines. Why did we do that? Because healthcare workers have a sacred obligation to keep patients safe. And we have a long history of doing that with flu vaccine, for instance, doing everything we can to keep our patients safe. And we don't want to unwittingly, unintentionally give somebody COVID because, somebody comes to work not realizing they're sick. And so we want to minimize the possibility that happens. And so we required vaccine. And let me tell you, incredibly effective. Obviously, it keeps our patients safe. It also big time kept our employees working this summer when we were going through this horrible surge. So they weren't out sick when we needed them most. I saw some other hospital systems closing community emergency rooms and things to deal with staffing issues. We did none of that because we preserved our staffing. And I will tell you, we have about 2%, a little less than about 1.7% of our staff have an exemption. So they didn't get vaccinated because of a religious exemption or a medical exemption. So 98.3% are vaccinated, 26,000 plus vaccinated, and about 450 not. We actually had 44 times as high a rate of being admitted to the hospital if you were unvaccinated as if you were vaccinated. So, it's about as good a captive kind of population. I know exactly what happens with our employees as you can find. Oftentimes it's hard to know, exactly a population's numbers. And so they work dramatically well. So for government to come in now and particularly tell hospitals who have this sacred obligation to keep patients safe, and keep in mind about 40% of the hospitals now in the country have mandated vaccine, and you're going to see most of the rest do so. To tie our hands to do that is really quite abhorrent from my perspective. It really flies in the face of kind of some of the stuff I said at the beginning. Let's listen to the physicians. Let's listen to the scientists. The preponderance of them believe in a mandate in a healthcare setting. You can get into discussion about, well, is that the right thing in other settings? And I think it's a valid conversation to have. But at the end of the day, my philosophy is that as a business owner or a business leader, a faith leader, a restaurant owner, whomever that is, they have a duty and an obligation to keep their clientele safe, or whomever frequents their establishment, and they have an ethical obligation to keep their employees, their staff, whomever is in there safe as well. Why should their hands be tied? Let them make those decisions that are right for them. To me, that is one of the fundamental freedoms we have as a country, and I believe very firmly in. So it's very disappointing that we have all this move to prevent and really tie the hands. The Texas Hospital Association came out very actively and saying, look, you're tying our hands during a pandemic, a critically difficult time. I heard one person give a little bit of an analogy. It's sort of like, prohibiting us from putting sandbags up when a hurricane's coming, or boarding up our windows when a hurricane's coming. These are well-known, safe things to do, and appropriate measures to take during a pandemic.
Yeah, and I saw the Texas Hospital. We have a question in the chat, but I saw the Texas Hospital Association signed the letter opposing those pieces of legislation. Texas Impact also added our voice from a faith perspective, saying we shouldn't be tying the hands of local congregations who both have a responsibility to protect the folks who show up, but also their employees. Do you have any advice for advocates who are listening, who plan on talking or meeting with their representatives about this issue? Any messaging, any thoughts you would share with them?
We are, like it or not, in a pandemic, and thankfully, I think we're entering a more endemic, which is kind of bubbling along, always there kind of phase of the pandemic, as opposed to these rapid and horrible swings. All of that can go out the window with a variant, but without a variant right now, it does appear we're in that situation, certainly in the greater Houston area and the Texas area as well, which is a good thing. But we have to learn to coexist with this. We have to be logical. We have to make smart decisions. We have to not overreact in either direction. But we need frontline businesses, hospital systems, faith institutions. They need the flexibility to do what it takes to protect their institutions and the people who frequent them. Schools are another example, of course. And why we would tie the hands of those individuals at a government mandate level, because that's what this is. It's a mandate to not do these things by our state government. So it's logically inconsistent. And it really does tie our hands when we have sick people, sick patients, when we have death still occurring and infection still occurring. Why not let that be made out at those local levels and decisions? And there's a lot of politicization of this. Of course, some of this is in response to the federal government's posturing, and more than posturing, the things they've put in place. We haven't seen the final rules yet. But don't forget that for businesses, what the federal government said, you have a choice. You can actually have your employees get vaccinated, or you can have your employees get tested. Well, most employers that I'm working with in our area who are responsible of any given size are already doing most of that. So, because they recognize that they have a large contingent of their staff who are vaccinated and who are quite upset at the people who aren't vaccinated and don't feel safe being around the people who aren't vaccinated. But they also recognize maybe they can't get those people over the hill, but then, okay, fine. Then you can get tested and at least we'll have that safety metric. These are not unreasonable things to do, and to tie everyone's hands is not reasonable. So please very loudly state that, you want frontline decision-making and the flexibility for all these organizations to make the decisions that are the right thing for their own employees, their own customers, et cetera.
I know early in the pandemic, and I don't know how long you were doing them. I tuned in a couple of times during the height, but you were providing advice to congregations and faith leaders, you or other folks from the Methodist team. We have a lot of faith leaders who will be listening to this today. Do you have any ongoing advice for Texas faith leaders or congregations about how they would continue to respond to the pandemic or future endemic?
Yeah, and that's been a real pleasure for me. I've done a lot with obviously the Methodist congregations here in Houston, many times, formally and informally, but also the Greater Houston Partnership and Interfaith Ministries put together for a while there was weekly, and I wasn't always the expert on it, but I was on it very, very frequently. It's been a great opportunity. And I will say now what I said then, which is, this is all about leadership and community leadership and who's a bigger, more important, more listened to leader in the community than our faith leaders, and it is so critically important. And, I believe we need to lead by example. I'm obviously of the Christian faith, Jesus tells us to love our neighbor, right? And how better to love your neighbor than to do the things to protect your neighbor and to not, accidentally give them an illness, to not knowingly or unknowingly, more likely than not, right, spread something. And I've struggled many times because, unfortunately, numbers just kind of glaze over for a lot of people to kind of have people understand the gravity of what we see, the conversations I'll have with a frontline nurse who is just pummeled by the fact that, 3 times in a week, he or she's had to hold a phone up to a person before they're getting a breathing tube put down their throat so they could call home and talk to a 12-year-old or a 8-year-old or a spouse or whatever, and essentially say their goodbyes because they're not sure they're going to come off the breathing tube. Because once you have a breathing tube, you're probably 1 in 4 or worse mortality when you have that happen. And depending on the situation and the scenario, obviously. So this is very, very real. And so to the extent you all can continue to help urge people to do the right things. And I will say, and I've had this conversation with friends and, who are pastors and some of my board members and others, it's very frustrating to, watch sometimes that the most conservative religious aspects in our community sometimes are sort of bristling at the vaccine or bristling at the masks the most, when I feel like we should be leading by showing, a love for our fellow humankind, based on the religious teachings we all believe in. And it's very hard to watch. And so I think that comes back to our faith leaders of really helping propel that message going forward.
Well, I know many of our faith leaders have felt that challenge, and I applaud all of you who are in that leadership and conversation, but we still have work to do. So thank you for that.
No, and let me be clear. I know all of you are doing that, and I have had those conversations time and time again and heard the frustrations in your voices as you're dealing with these same kinds of sometimes uphill battles, or you're dealing with people who are upset about a mask requirement or, other things associated there. And unfortunately, that is the state of our society. But, you all are so highly respected and such key individuals in getting good information out there.
Yes. Yeah. So, last question before we start to close this out. I feel like I'd be remiss if I didn't ask this question. We are looking at kind of perpetual special sessions, and we might have another one, we might have 5 more, I don't know, but at some point the Texas legislature will convene again, and vaccines have taken up a lot of the space in terms of public health over the course of the last few months, but there are a lot of issues that go into a solid public health infrastructure here in the state of Texas. So is there anything that you wish Texans or the legislature were thinking about as we move into whatever the next session might be to help protect the health and well-being of Texas communities?
Well, I mean, first and foremost, given the tenor of things today and where things are, please stay out of medicine, and please stay out of, pushing back against scientifically validated facts. Let the public health experts and the physicians and others drive the right things to do. We had so many people die, and we could have avoided so many of those deaths. We could have had better control of all of this if we'd had better locking of arms and doing the right things and listening to those experts. And unfortunately, that hasn't happened. When we think about, unfortunately, the next time, we have grossly underfunded public health infrastructure at every level in our country, at the federal level through the CDC, whether you talk about the state level, you talk about the local level, and tons of really good people working in there. I've gotten a chance to work side by side with many of them, at least figuratively many times. But we have to step in as these large, sophisticated hospital systems and oftentimes do a lot of the work that should have been happening with public health, simply because there's not enough people and enough funding. So we have to rethink that structure and how we're going to be ready. And that's where I'd like to see a lot of that time and attention focused at the government level is, how do we get ready for the next time? Because we have to have a different infrastructure in place for the next time. And given the globalization we experience, a next time is inevitable, whatever that looks like. And none of us, have a crystal ball and know exactly what that is. The other thing is, we are dealing with a very exhausted healthcare workforce who has been through the ringer time and time again. We are going to feel that impact for quite some time. There are people leaving the profession. There are people retiring early. There are people experiencing, struggle and burnout and many other issues. And we are going to deal with shortage of nurses, shortage of physicians, shortages of radiology technology, radiology techs, of physical therapists, respiratory therapists, you name it. And we have to work together societally, and oftentimes government is a big part of that, is making sure we have the pipelines, making sure we have the ways to get enough people into nursing school, into school to be a physical therapist, or whatever the different specialties are, obviously positions for physicians, et cetera. That's where I'd like to see the effort and the time and attention focused.
I appreciate that. Again, I said at the beginning, I'll say it again now. My family and I just love Houston Methodist. My parents both got their vaccinations there, and just really appreciate the leadership you've shown over the course of the last year and a half. Anything you'd like to leave us today in terms of shameless plugs where we can find more information, what you guys are doing?
Well, you can go to HoustonMethodist.org if you want to find anything out. If you want to see guidance around getting booster shots, for example, or if you haven't gotten your first or second shot, go get them now. Or if you have people you're working with, I tell people, it's one arm at a time, right? And every one of us, if you can bring one more person to the table, we can continue to chip away at this and do better. We still vaccinate people for their first dose every single day at Houston Methodist. It's not tons, but it's a couple hundred every day. So again, we keep ticking away at that moving forward. But all that information is there on our website. Go to HoustonMethodist.org. You can then click on a vaccine link. You can look at all the data about the status of where things are, other education that you need. Please bring people along into the fold. Help get them vaccinated. You'll see on the data, we have now, I think we're around 935,000 doses of vaccine that we've given. We've had tremendously good experience giving 935,000 vaccines very safely, and know that it has made a dramatic difference. And I'm very proud of the men and women who do that. So please join me in thanking all of them for their hard work as well.
Absolutely. Well, Dr. Boom, again, thank you so much for the incredible ministry you and your team are doing every day. And thanks for spending this time with us this afternoon.
Thank you. It's a pleasure to be here.
All right, thanks again. Well, friends, I'd certainly like to thank Dr. Boom for the conversation today and the challenge that he had for us. I'd also like to thank you for tuning in. And remember, if you have stayed on this podcast for this long, please make sure that you leave us a rating or review. Give us the best rating so even more of your friends, even more folks out in the world can find this content and join the work for justice here in the great state of Texas. Also, remember to keep an eye on Texas Impact's social media and website for upcoming announcements, or you can always email me at scott@texasimpact.org with questions. And remember, if you appreciate Texas Impact and the Weekly Witness community, please make sure that you and your congregation are members by going to texasimpact.org/join. Friends, these are unprecedented times. There is a lot going on in the world, and more than ever, we need Texans of faith active and engaged. So let's get to work.